Good evening and welcome to tonight's Power Hour. I am being joined by Maud, one of our osteopaths in the Cambridge Clinic, and I am Jenny, a sports therapist in Hatfield and St Albans. And today we are going to be talking a little bit about ourselves and our qualifications and the difference between osteopaths, sport therapists, but how we come under the umbrella of PB clinics and how we all work together. So Maud, tell us a bit about your qualifications, where you studied, and how long have you been practicing?
Yeah, of course. Hi, everyone. So qualification is basically a master in osteopathy. So I did this at the European School of Osteopathy, which is a school in Kent, in UK. And basically it's a 4-year course. I came to England to do it. 4-year course, really intensive, with 2 years in practicing in a clinic attached to the school, which is actually great because you get lots of online hands-on, not online, hands-on treatment already, experience with patients and how to deal with kind of conditions and things like that. So now I've been practicing at the PB clinic for a year. And really enjoying it. And I think what brings to osteopathy this school is really good because you also get to see a lot of different people. So you're with so many different range of people, and that helps me to change my practice and practice in a different way as well with patients. So that's great.
Yeah, great. So for those that maybe aren't quite sure, because there's so many different health kind of professionals that can help with kind of musculoskeletal and you see in private clinics, what is osteopathy? What do you do kind of day to day in the PB clinic?
Yeah, so I think there's like lots of people think of osteopathy differently, and there's a lot of different techniques in osteopathy, a different philosophy, things like that. But I think the most kind of core center of what we do as osteopath is working holistically with the body, which means that basically we don't really concentrate exactly where you feel the pain. We would look kind of above, below, and your whole body to see if there's anything that brings on the pain or if the pain is actually coming from somewhere else. So we're really trying to find the core problem that's bringing on this pain and this problem. So it's finding the source rather than treating the symptoms. It's finding exactly what's happening to make sure that this doesn't come back in the near future. You know, those back pains that just keep on lingering years and years after years, just like, oh, yeah, every year I'm getting this, or every couple of months it's coming back and things like that. Usually that's ringing a little bell thinking, oh, there might be something else going on. They might be doing the same thing every time to get that problem. And in their body, there might be something that always brings that on. So I think that's the main thing. We're working with the whole body holistically, also with lots of different systems within the body. So that's what's interesting. We work with muscles, with the fluid, so the circulation within your body. We work with the joint mobility and the structures within neck, back, all of the spine, a ligament injury, I think all of that. So yeah, I think it's pretty much inclusive. So I think that's what I love as well, is like you treat everything and you can help anything that's happening within the body.
Yeah, you kind of look at like the really big picture of the patient and not maybe just like the injured area. And there's a lot of different types of like osteopathy, isn't there? I know we've got a lot of different osteopaths in the clinic that specialize in different areas.
Yeah, so there's different techniques that everyone do. So basically, one of the main one, people are more what we call structural, some people, which is more working with the joints. It's a little bit like, you know, when you see a chiropractor and you do like the manipulation, what we call HVT, sometimes when you can hear some clicking or popping, working with the joints more and things like that. That's what we call more structural osteopathy. Then you have more as well cranial osteopathy, which is another type of osteopathy working on different systems within the body, which is a little bit more gentle, but really nice as well. It's usually what we use treating babies, which I've done training on, and it's amazing treating babies. So that's as well something really nice to do. So I think, yeah, with lots of different things. And what was nice with my training in particular is that you get to open up to all of it, to all of this technique, and then you kind of choose what works for you and how you prefer working. So
Okay.
I swap around as well, depending on the person, depending on the condition, and depending on what they're coming in with. Um, I kind of
Yeah.
feel see what work best for them, and I can swap around which techniques or which types of osteopathy I want to do on that particular problem.
That sounds good. So, just adding in something to that, what would be like a typical session with Malden Cambridge? If I came in maybe with a neck or a back, I've kind of been advised that you're the girl to see. What kind of stuff would you do? Would you make me remove any clothing? Would you make me do certain movements? What kind of treatments?
Yeah. So
How's
I
it?
think first of all, when we start, some people can be a little bit kind of scared of it. Is that we ask a lot of questions,
Yeah.
and I do. I kind of go to the bottom of things. I ask a lot of questions about how the problem arrived, how long it's been there, um, if they tried anything, how it's progressing, what makes it worse every time. Really trying to understand what's happening. So you're already trying to make an idea of exactly what's happening within the body at that point in time.
Yeah.
What also first appointment I do ask a lot about the past medical history. So that's to make sure that I don't miss any underlying problems, so anything a bit more sinister or anything else happening with the physiology of the body that can help me with guiding treatment.
Yeah.
It's also thinking about previous injury, how previous injury affects the body and affect the way we move, affect the way the person is going to change using their body. So that's what I basically do. Lots of previous injuries, any medical condition, medication, things like that, asking about all
Yeah.
of that. And then typically I would then want to process to an assessment. So that will do some assessment. So looking at how the spine moves, the body moves, seeing if there's anything changing within that. Usually asking them to remove, for example, if it's lower back, probably the top as well. If it's lower limb, it will be going in underwear. If people are not comfortable, it's always bring a short or a top that I can see shoulder, for example, if it's shoulders and things like that, try and see this area and be able to actually touch and have a feel of the area as well, of the muscles and the joints and things like that.
Yeah.
Once I know what's happening with the testing, we then go on to like a treatment on the first session treatment and see
Okay.
what we can do
And
for.
it sounds like the main kind of treatments that you do, as you say, these kind of manipulations where you're cracking things, and kind of what's really basic. What's like the theory behind that, and is there any other things that you give, like any exercises or any other hands-on stuff?
Yeah, so I don't only do this one, but what I do usually it's like I do a treatment and then at the end, if that's more on the spine, well, no, it's everywhere, but I do for the spine, I do usually at the end, just after having releasing and moving a little bit everything. If there's still something, an area in your spine, for example, or in your feet or wrist, things like that, that are a little bit stiff, that I can feel that it's a little bit stiff and not kind of moving too well or in harmony with the body. We then perform that type of manipulations, which then
Okay.
improve the mobility. So it sends a neuromuscular. There's lots of theory, so nobody's really sure, but what
Yeah.
I'm going with is the neuromuscular input from the spine all the way to the brain, and then goes down into your spine, and then allows the muscle around that joint and that segment of spine to relax, which then allows the spine to move better and then makes you use your body more effectively afterwards.
Good.
Yeah.
Perfect. That sounds great. So what do you kind of like doing in your practice, and what's kind of your like maybe like maybe a bit of a specialty? What kind of areas do you like treating?
I see a lot of neck. I think I really like treating neck. It's a nice area. Shoulders and neck through here. Lower back, something that I see a lot. So getting really good at that, and it's actually
Yeah.
really enjoyable because there's so much more to it. You can look above, you can look then at the hips, at the knees, at the feet. So I think that's what I like, is like I have specialties, but then I always need to look further. So at the end of the day, I'm good at treating every part of the body, because it's, you need to, if there's a problem with the back, actually not only treat the back, I'll treat the hips and see if there's anything below as well that's maintaining that problem up in the back.
Yeah.
So, but I also really enjoy treating babies, as I said before, or pregnancy, during pregnancy as well. So pre and postnatal as well is something really
Okay.
enjoyable. It can really help the woman feeling better during that crazy time of everything changing in the body, everything kind of trying.
Feeling pain everywhere and
Yeah.
not being able to sleep. And
We never change that much through our lives, and when we like are pregnant, it's really really changing throughout the body. And so sometimes a little bit of help manually can help people to just
yeah,
and cope with it a bit better. So that's what I really enjoy in the clinic. Yeah.
that sounds great. Perfect.
And just one thing as well about exercise. I think I do give exercises and kind of advise on stretches and things like that. But I'd probably say you'd be the person to go and see for all of those exercises. So,
Yeah. So
yeah,
so I'm
on just like qualifications, and then
yeah. So I am a sport therapist. So I graduated from the University of Hertfordshire around 3 years ago now. So I've been practicing for 3 years. I am quite new to Perfect Balance, although it feels like I've been here for ages, kind of in the last few months. And my course was a 4-year course as well. However, it was just like a standard 3 years of learning, and I had the option of doing a placement year between my second and third year. So I am from Bristol, so I actually spent the year working at Bristol City, so the football club, which was really, really good. Yeah, so that's kind of my qualifications.
Interesting. So what do you do usually in treatment? How do you treat? What do you do? And which type of people do you usually see in treatment?
Yeah, so as a sport therapist, I'm kind of similar, but also very different to Maud. So I can still assess and treat kind of all of the areas of the body. So peripheral joints, shoulders, knees, ankles, wrists, but also I can treat and assess necks, backs. However, my main kind of areas that I look into is more peripheral joints, and it's more for people who are active or are participating in sports and activities, going to the gym, and have maybe injured themselves through sport and activities. They're usually the people that come in. And yeah, so a typical session would be maybe somebody's come in, they're a runner, and maybe they have just started getting back into training and they're noticing pain to the front of their knee. So as Maud kind of does, I ask loads and loads of questions, but for me, the main focus is more on how did it happen, so the mechanism of injury. Mainly sports people don't really come in like the average general population where they've had something for a long, long time and they've just let it kind of linger. Usually they've definitely be able to tell you that 2 days ago when they were doing a run, they felt something pull. So mechanism of injury is a big thing. Obviously, we still get those who are a bit lazy at getting their injuries sorted out, and it can be a bit hard trying to work out when things happened. But I also focus on why maybe the injury might have happened if it isn't overuse. So looking at any changes in training, so frequency, low duration, things like that. Maybe changing of surface, changing of footwear, or technique, things like that. Anything kind of sport related for individual sports, we kind of look into training. And then, assess, like Maud said, assess kind of the specific area. Again, as a sport therapist, I was kind of more taught to assess that particular joint. But if things aren't quite adding up to look above or below. And then obviously provide hands-on treatment. So the hands-on treatment I do is slightly different to mold. So I don't do any of these manipulations. I'm more kind of soft tissue based. So I do quite a lot of dry needling. So popping needles into tight muscles or into painful areas. Deep tissue massage is a big one. I think everyone kind of knows what deep tissue massage is. Yeah. And I get a lot of people sent my way for the hard deep tissue massages because apparently I've got very heavy hands. Yeah. But yeah, so kind of soft tissue techniques like that. But I also do a lot of mobilizing of joints. So mold kind of does the very high end, the manipulation, where it kind of takes the joint throughout the whole range, slightly out of it and then back in, which is that clicking noise. Whereas I kind of work just within the range. So trying to improve mobility, decrease pain. But I would probably say the biggest part of my job is the rehabilitation side. So whereas a lot of the different practitioners, so chiropractors, osteopaths, just kind of give basic exercises, it's me that you would come to if you need a full rehabilitation session. And usually that is more athlete based because like your general population, if you've kind of rolled your ankle, as long as you're kind of at a level where you can function, you can walk, you can go back to daily life, fine. But if you're kind of a top level sprinter, that is not going to be good enough. So we kind of need to push that to the next level with high intensity, hard rehab exercises and like a return to your sport drills. So yeah, that's kind of what sport therapy is. Very, very tailored towards athletes. But on the other side, I do just see like your general people that come in with like your tendon problems or your muscle strains because you've, I don't know, done something crazy and you've tried to race your kid down the road or something and you've pulled it. Because all the same things apply. But yeah, so that's kind of sport therapy in a nutshell, really.
Yeah, no, that's really interesting. I think we kind of like, I think probably hands-on, we kind of, like mobilization and things like that, we do use as well. And I think there's, we just then, I guess, the little bit add-on, if there's something a bit more like what I talk about, viscera, for example, that's something that's really interesting to do with sort of digestive problem and things like that. Sometimes you can really help with like, even the normal mobilization, help moving the fluid within the body, moving everything through, help with like getting congestion through the lower limb, then he helps in everything going back up in through the heart, through things like that. So
yeah, of course.
Looking globally at the body, and you end up doing the same thing, which is really interesting. Yeah. And so that's why we can also work together. So I do probably diagnose what's happening, try and do hands-on, but then definitely if it's more of a sporty person that needs to get back in there, like training full on, I'll send the way to like sport therapists. And I think that's how we work together as well at the Perfect Balance Clinic, isn't it?
Yeah, definitely. I've found that there's so many different specialities. You've got like osteopath, sport massage, sport therapy, physiotherapy, nutritionists. We've got a whole wide range of people. Yeah, and I think what I found is, in particular, I get a lot of the athletes, which is great because obviously that's exactly what I do and they need the rehab. If it's something which, let's say you more just see in somebody general, but you think that they need a bit more of rehab because maybe they've got quite an intense job where they have to do quite a lot of walking or going up and down stairs, that's kind of when you've done all of your treatment, the actual injury is feeling loads better. That's probably the point where you'll probably say, right, let's refer to Jenie, the sport therapist, and she can just finish you off with the right exercises. The same with me. Sometimes I get like some general problems or maybe maybe even a sporting person where I'm kind of thinking there's something not quite right here. Maybe they need a manipulation, so I'll send them your way. Maybe there's something not quite right with the diet, so we'll obviously send them to a nutritionist. But I think as a clinic as a whole, everyone's specialities are great and everyone's great at their speciality. But I think what makes the clinic awesome is just how we know each other's strengths, and we can say, actually, this isn't something for me. I know that so-and-so will be amazing at helping you finish your recovery. And that's not, I wouldn't say it as us like passing them on and like trying to get rid of them, some people say to me. It's just trying to provide the best care for the patient. And I mean, we talk all the time as a company.
Yeah, I get loads as well of even kind of sports injury or things like that, or injuries that are tendons, things like that, so that you need to rehab. So I go through the first bit where you decrease swelling, you do lots of hands-on, decrease like muscle tension, you go through the joint trying to improve the mobility or look up and below. And then sometimes you do alongside with kind of rehab. So then I send them alongside of my treatment to get some exercise specific for that. And that's what's really important as well. It's like if you really go to a sport therapist, I think you can get those like great exercise, very specific to where you want to get back to. So as you said, like if they need to go sprint, they need those specific drills and exercise to get strength back, and to not have then an imbalance between both sides. So it's going back and better actually, and kind of better than they were before. And so it's not us trying to like, get rid of it. It's us trying to
seen you 5 times, bad enough.
Exactly.
Definitely not. Yeah.
No, it's deal with like the best way that we can to help the person. And I think that's why like the whole at the beginning of the session talking bit, for me, I find it really important because I find out exactly what they need. Because if they come and they tell me, I've tried this type of things, but it hasn't worked before, then I'm like, okay, well, let's not try the same thing.
Let's not try that. Yeah, let's not waste your time.
On trying to push on that and make you have more sessions for that if that hasn't worked before. So then you know where to guide them and where to kind of lead them in a way that can help them as quickly as
I think I'm the same, and I tailor a lot of my questioning at the beginning, always relating it back to actually what do you want to get out of this, what do you want to be able to do. For me, that's quite easy and obvious. It's like I want to get back to running 100 meters and achieving PBs. But for general people, it can be things like just something simple as like playing with kids again or driving pain-free. So I think that's a big thing relating to goals. And if they say, for me, usually it's get back into training or get back into the activity and making sure it doesn't happen again, because usually with athletes, they hate being out of training. So then I'm kind of thinking in my head, right, I can get them, 70-80% of the way there. And then maybe I refer them to our Pilates team, who does a lot of core and prevention work, or to the massage girls that are men and women. That was a bit biased then. Or to the massage team, who maybe takes them through like some recovery stuff for when they start getting back into training. I think although it might seem that we're being very delving very deep into quite a lot of questions, it's all to try and work out you as a patient as a whole, using this holistic approach, and how us at PB using our 360 approach can get you back 100%, and actually even better than that, even better than potentially what you came in as. But that's what I see it as anyway. And
I think what's really nice as well is that I feel like we all have our space as well within it. So it feels like I'm always saying that everyone has their bits to do within like that patient or within a patient. It's like we'll help in a different way, but at the end of the day, our goal is the same, and to get that person better. And
Yeah, perfect. So, yeah, I hope you guys have enjoyed that. That's a little bit of an insight into two of the lovely therapists at Perfect Balance. And yeah, as always, if you have any questions or you might want to find out a bit more about the other services and how they differ, then just comment below and me or Maud will be able to get back to you or visit our website. Yeah, so thank you for joining us.
Thank you, everyone, and see you.
See you.